Okay, let's bring this all together. And now that you understand a little better how this medication works, what to expect with your treatment, how to optimize your results, and how to maintain your success long term. Just remember this. This medication, again, is a tool, but you are the one creating the change. Stay consistent, stay patient, stay committed, and most importantly, take care of your health, not just for weight loss and the number on the scale, but for your life, your energy, and your future. This is one of the most important parts of this entire course, so I really want you to hear this. Where you get your care matters. Right now, weight loss medications are everywhere. I tease and say it's like the wild, wild west of weight loss. Med spas, online program, quick starts clinic, the mall. I've even heard of dentists, plastic surgeries, dermatologists, psychologists, all selling or prescribing weight loss medications. The compounded ones, of course. And while access can be helpful, not all care is created the same. Honestly, right now, it's about money, unfortunately. Yes, these medications are powerful. They're changing lives. They're in demand. They work. But truly, that's just one piece of the puzzle. If no one is evaluating your metabolism, your habits, your likes, your schedule, your sleeping habits, and yes, your hormones, you're setting yourself up for failure. If no one is talking to you about nutrition, protein, or maintaining muscle, if there's no long-term maintenance discussion looking into the future, there should be realistic goal planning and how non-scale wins are still a wins, then you're not getting complete care. You should never just worry about the number on the scale. Yes, the number is a measurable tool that we use to show progress, but it isn't everything, and it doesn't mean that in the long run, you'll stay there. As I've said 100 times, obtaining and maintaining can be two different things without the right provider, tools, and team to help you. You're just throwing away your money, your time, and your emotions. It should be about your long-term health, your metabolism, and your ability to see and maintain your results. So let's talk about some red flags in your weight loss care before you spend a dime on these medications. Yes, you can get medications just about anywhere, like I said, but be wary of the following. No labs or evaluation by a knowledgeable professional that is trained in obesity, the same plan for everyone or protocols, or a cookie-cutter approach. If there's no discussion on nutrition, planning, what are your likes and dislikes? What is your long-term plan? If you're only focusing on the scale and there's no discussion about movement, muscle, sleep, or the other, what I call cogs in your wellness wheel, those should all be red flags, and I want you to be aware of them. There are a few red flags I also want you to be aware of when it comes to your actual visit. If your care feels rushed, like an in-and-out 15-minute visit, that's very common in traditional practice or online programs, that should be a red flag. You should be able to have an open discussion about what your journey is and the struggles that you're having. If everyone you know is getting the same plan and the same dosing, if no one is asking you about your nutrition or lifestyle, those are all signs that the focus may be on quick results and not long-term success. And that's where people often run into problems later. Yes, we all want results, I get it. But I see hundreds of men and women that lose and find the same 20 to 50 pounds their entire adult lives, and it doesn't have to be that way. It's not asking too much of your health or your provider is a personalized plan, a discussion about metabolism, proper movement, and a complete history and nutrition and protein guidance, and a muscle preservation plan, and a long-term strategy. It sounds like a lot, but good care should feel personalized. It shouldn't feel rushed. And you should understand the why and you're doing what you're doing and not just be told, take this and when. There should be a plan not just for weight loss, but for maintaining your results and your health long-term. Don't waste your money or your time and come prepared to your visit. This is where you can really take care of your health by showing up prepared. Because your visits, even if they're rushed or you only have 15 minutes, if they're unstructured, an important piece could be missed. So before your visit, know your current medications and why you're taking them. If they don't ask or they don't consider other medications, this is a big red flag. Your provider should discuss each medication, why you take it, and any other issues that may help or hinder your long-term success with weight loss. They should ask about your typical daily habits. Are you eating? Are you sleeping? What are you eating? What's your weight loss history? What are your goals? Are they realistic? Before your visit, take a few minutes and think about, what is my baseline? What do I eat on a typical day? How is my energy? How is my sleep? What do I crave? What do I like? The more clear you are with your provider, the more productive your plan can be. For example, when someone tells you to load up on protein and start your day with a protein shake, you may hate protein shakes. So they can say it all day long, but you're not going to drink a protein shake. So we have to find realistic protein sources that you like. Everything with protein is not great. Remember, a moon pie with protein, still a moon pie. Ask these questions to your provider, such as, what is driving my weight and my metabolism? What's hindering it? How do I protect my muscle? What is important in me building muscle right now, and how much muscle? How much should I be eating? What if I'm a picky eater? What is the long-term plan for maintenance? And how do I stop, or can I stop? You deserve answers, not just prescriptions. Asking the right questions help you understand your care and ensure that you're not just going through the motions. I say all day, every day, anyone can lose weight. We know what it takes to lose weight. The real question is, who is helping you keep it off in a healthy, sustainable way? Who is hindering that? That's the difference between short-term results and long-term success. When it comes to these medications, a personalized approach is important, and even the dosing is important. An inexperienced provider will often follow what the FDA-approved name brands have as far as dosing. And that's okay, and it does work. But again, one of the cogs is affordability, and more medication doesn't always equal more weight loss. So I always explain it like this. Imagine that you're casting out this net and you're trying to capture hunger and satiety, which means you eat less, which is part of the medication, and weight loss falls in there. Anything on the other side is you're in the weeds and you've picked up side effects. Anything over here, nothing's happening, it's not working. So trying to figure out that balance, and again, not the cookie cutter approach, but your dose. What is your dose? What works for you? I have patients that have successfully lost 60, 80 pounds on a very minimal amount of medication with the right coaching, with the right tools. And that medication is so much more affordable when you use less of it. The majority of this class is based on treating an adult that can make their own choices, that can get to the gym. And that's really who I'm targeting during this class. But if you know or love a teen or adolescent who's struggling with weight loss, and you think it may be a metabolic issue and not like I need to lose a few pounds issue, if they're really struggling, stay tuned for a very, very important course that's directed just to your teen and you, so that you can help them with not only short-term results, but a long-term impact. Part of the problem I see, and this is why I think the teen and adolescent class is going to be so important, is that if young girls, particularly with PCOS, with metabolic problems, and even young men with testosterone problems, if they're not guided early, they're going to end up in the same spot where they have a lifetime struggle with weight, body image, and even eating disorders. So stay tuned for our class specifically designed to help teens and adolescents overcome challenges that's going to lead to lifetime problems with obesity.